Hello, everybody. My name is Dr. K from K2 Health Center, and I'm here with Tricia. And Tricia's been a patient here at K2 Health Center for a couple weeks, and so I thought it'd be nice to sit down with Tricia and hear how she's been doing.
So I knew that, I had a lot of neck pain.
Yeah.
And I had a lot of pain in my lower back.
Okay.
And when I came in, we sat down and visited with you about what we were going to do about it. So traditionally, it's not what I expected.
Okay.
I totally was surprised.
Yeah.
Being shocked that the normal chiropractor kind of just throws you on the table,
Whips the magic on you and does the adjustments.
Yeah,
Okay.
and it's it's a little scary because you're like, you have to have a lot of confidence and faith in a stranger, and so when you find one, you're like, okay, and you get used to it, but at the same time, in the back of your head, you're like, boy, this doesn't seem right.
Yeah.
And so I was anxious to come,
Okay.
but when we sat with you, you explained your skill sets and your competence, which was really good because you actually communicated. Like, we had a conversation.
We did.
That was pretty awesome.
Yeah, I heard from you about what you were dealing with, which had been years and years of accumulated neck pain and low back pain, kind of spinal tension in general.
Right. And the neck pain was the worst.
Yeah.
It was just constant.
Yeah. And how was that affecting your life?
I'm pretty stubborn, but I kept going. But it was, yes, 100%. The sleep, everything.
Okay.
And so you kind of morph your body into where you put the pillow to make sure you can actually sleep without pain.
Okay.
So
modifying your day-to-day life just to get by.
Yeah.
And you came in, we did an evaluation, and we found that your head and neck at the atlas bone was twisted out of position. And we ended up doing that initial correction a couple weeks ago. How did that go for you?
I was really surprised. I thought it might be quite a deal. I was a little nervous again, but it wasn't. It was just like a little poof of air, and it was simple.
Okay.
And I stood up and walked normal. But what was cool is you did an Xray before we did it.
Yeah.
And then you did the calculations and showed me an actual scientific, mathematical way of how much I was out.
Right.
So then when you did the correction, I couldn't tell a whole lot of difference other than the pain wasn't as bad, obviously. Yeah. It was like remarkable.
Yeah.
But then we come back and you X-rayed again and could show me the advantage and the changes.
Definitely. So what we did was we took a set of befores showing the twisting in the neck. Mm-hmm. Then we did the treatment, and then we took the afters right away and showed things lined up better posturing, better positioning of the atlas. And so that translated into
just not having any pain when I was sleeping. Excellent. And I actually corrected my sleep because I felt better sleeping like I'm supposed to, which was kind of odd as well.
That's so
because
great.
I've been doing it for years. So
that's so amazing. And now that you've been under care for a little bit, is it interesting? Do you notice any differences from when you're in alignment versus out of alignment? Because you come in oftentimes and we don't have to do treatment because you're balanced up and feeling good. But what do you notice when things shift?
We're going right back to the serious pain.
Okay.
But mostly I'm just aware of what I'm doing now. I'm trying to hold my posture different. I'm trying to correct what I'm doing that's causing it to get out.
Good.
And so I'm more conscious.
Awesome.
Very aware.
That's so excellent. Well, thanks for sharing your story. And for anybody else out there looking and trying to basically get the word out that head and neck alignment is super important for your health. And
been telling everybody I know.
Oh, that's fantastic. Yeah. Thank you so much.
I'm trying to get him to travel with us and see all my friends.
Head out to Oklahoma.
Yeah.
Yeah, we'll be out there. Well, thank you so much.
Okay.